Hey everybody, hey everybody. Sorry, I'm a couple minutes late today. I'm just signing on. Hey. So I see that there are some folks on today, and let's see here. All right, welcome. This is my Facebook page, and today I'm going to be talking about sexual health. September is Sexual Health Month, so this week we're going to be talking about orgasmic meditation, which I'm sure most of you have not heard about before. Next week, I think we're going to talk about issues that have to do with men, which I've talked about before. And then the week after that, I'm going to talk about women's issues. And then the 24th, I'm probably going to talk about Tantra, Pilates, forms of yoga, other exercises that are great for pelvic floor, which helps in sexual performance and in sexual functioning. So, all right. And hit the thumbs up, hit the subscribe button, hit the like button if you are tuning in today, and if you've been watching my videos, give me some love. And so this video will be posted on YouTube within the next week or so. And I'm kind of behind on posting my videos. I'm gonna get caught up today and on YouTube. But there are other YouTube videos there from the past that you can watch. I have a whole series on COVID. I have a series of videos on Facebook on COVID as well. And you might want to watch my video from March the 3rd on COVID that's on Facebook, because we're getting to, the weather's gonna start turning and we're getting into fall. So you're gonna want to kind of stock up and get ready because the flu season is coming. And what we're looking at is a layering of the COVID second wave on top of the flu that's coming from China at the moment. It always comes from Asia every year, this time of the year. And some months ago, they had the first cases, and unfortunately, there's a swine flu that's on the way. And there's not really a vaccine for the swine flu. They have a vaccine for influenza. Swine flu is the H1N1. I believe they're probably working on it, but I don't, they are not publicizing what's going on with that because I think that they don't want the American public focusing on it at the moment. But this is something that, any kind of viral illness that's like spread by water droplets, like the swine flu, influenza, SARS, like the COVID-19, they have, all of them have similar mechanisms in the immune system. So they're, you can prepare your immune system. You can also take care of yourself by getting enough rest, enough exercise, enough sunlight. Two big studies that have come out in the past month, they are finding that most Americans are deficient on vitamin C. They are also finding that most Americans are deficient in vitamin D, which we knew on the East Coast and we knew in the Midwest. We've known that for years, but most patients don't know it. I think it's becoming more common knowledge now. So let's get ourselves ready for the virus season that's coming upon us. And all right, so today we're going to be talking about orgasmic meditation. I don't know how many of you have heard about orgasmic meditation. Some of you have probably heard about Tantra. This is not Tantra. This is not yoga. This is not a form of exercise. It's a form of meditation. And, you know, it was created probably in ancient times by some indigenous people somewhere. But this woman named Nicole Daedone has written a book. You can find it on Amazon. I think her last name is spelled Daedone. And I found out about it from friends of mine that are in the DC area that are teachers of the method. I also found out about it when I was in Mama Gina's School of the Womanly Arts, located in New York City. In that sisterhood, I believe that Nicole Daedone had come and given some talks to that group. I also found out more about it because I did some research and found out that there's an OBGYN who published some papers there are some papers published by Rutgers and funded by NIH. And they're out there. These papers are out there. You can look them up if you look up orgasmic meditation, Rutgers, and look for the functional MRI images. While we're on here, I'll see if I can bring those images back up. I did have them up earlier, but I forgot to cue them up for the conference. But anyways, what I want you to also realize, the first point I want to make about the method is that you need two people to do it. You know, if you are in a relationship, you can get your partner. If you're not in a relationship, you can start networking in the community of people that practice this method. I know there are a number of people that are in the DC area, the New York City, Philly. There are people on the West Coast, in the LA area, and also in Northern California and in Southern California. So you would have to do some research. You have to be careful. The woman who is participating in this method is partially disrobed. So it has to be a person that you can trust and that for females that you know is not going to intentionally hurt you. So that's one thing. Hold on just a second here and let me find this document that I had queued up. Let me see here. Today is Thursday. Also, there's a good article on, what's the guy's name that makes the Bulletproof website, had an article about orgasmic meditation. And you can go there and look that up. You know, that guy, he always has great articles. Dave Asprey. Okay. Let me see here. Oh, here it is. It's called Brain Activity Unique to Orgasmic Meditation. So let's see here. Let me share my screen. Okay, we're going to get a little sciencey on you guys today. So I just want to show you that they have done research. Okay. Looking at women's brains before and after orgasmic meditation. And there are a number of studies. Why is it only that I'm only seeing the after? Okay, here are the images before orgasmic meditation. And these are the ones that they use to compare to the post images. And you can see the active areas of the brain. You can see this little plus sign cursor that I'm moving around. The cerebellum. This is a frontal cortex, the gyruses. So these are kind of areas where you normally have activity for a person. You know, they're not doing a whole bunch, but they're like at rest. And you can see too that it's predominantly on this side of the brain, which is probably the left side of the brain because the images are usually flipped. And the left side of the brain is more active in someone who's right-handed. So, okay, then you look at where things are lighting up. It's more diffuse. The emotional part of the brain is this part of the brain. And it looks like that's lighting up. It's got higher activity. There's activity in the hippocampal area, cerebellum. So it's really interesting. They've also done some studies showing that people that do this practice feel more fulfilled in their life. They feel more energetic. They feel more happy more of the time. It helps with depression. So it's actually like a really useful way. It's a really useful way. Let's see. I want to get it back here. It's a really useful way to keep people mentally focused and strong. The women that practice it with their partners regularly just have higher life satisfaction, just higher levels of the happiness hormones like serotonin, oxytocin, etc., and less depression. So, okay, I talked about the scientific side of it. So, you know, there's good reason to do it. And there's good reason to learn the method. So it's also safe. There are no medical issues with doing it. And the partner just has to have a functioning finger and a functioning brain so that they can make the person that's receiving feel safe, and it has a systematic method so that it's done the same time every way. It's kind of every time, and it's kind of clinical actually, the method. So you aren't supposed to vary from the method, and that helps people to feel safe as well. It's very helpful for people that may have had some barriers in having good sexual functioning for both men and women. So, or I don't know if I should call it barriers or if I should call it challenges. I'll call it challenges. So, all right. So we talked about the safety. We talked about that there's a systematic method, and it's also goalless, GOALLESS, goalless. So that means that unlike the regular or the normal sexual interaction, you're not trying to achieve a certain endpoint or a certain outcome. So that takes the pressure off of both of the people participating, that there's no outcome that's being sought. So I think it's very worth looking into. And like I said before, it is intimate. I am going to pull up here. Let's see. I want to show you One Taste. So the website's called One Taste US. onetaste.us. And if you go to that page, let's see, I'm going to share the screen so you can see where I am. Share the screen, share. Okay. So you can see this is One Taste. And you know, you can hire people to train you that are professionally trained. And I didn't mention this is good for trauma and healing for both partners, actually. There are benefits for men, and they have a video on the website about that. You also can go on YouTube and look up either orgasmic meditation or One Taste, and you will find some demo videos that were very tastefully done. It's not pornography. And so, you know, there's a lot of information online. There's a lot of testimonials that you can see that people have. So you can look into it for yourself. I just wanted to spend one of the sessions that I'm doing on Facebook Live this month on orgasmic meditation. That's called orgasmic meditation, or for short, it's called OM. And if you have any questions about it, you can post them here and I'll answer them in a timely fashion. And again, this is September, so we're going to be talking about sexual health in September. And I look forward to covering the rest of the topics with you. And, you know, if your partner has questions about this, maybe have them watch the video. This is not something to improve your partner's sexual performance, although they will find this enlightening if they are having trouble with their sexual performance, because it's something that's therapeutic for both sides. I know a lot of men don't want to, they feel that they know everything. I also know that I see a lot of men who, both young and older, so I see and talk to many men who are having sexual performance or sexual functioning issues for various reasons. You know, older men, it's because their prostate function, they're having issues. Younger men, it's because of the same issues that are causing metabolic syndrome, problems with blood sugar regulation, causes sensitivity of the gonads and of the sperm production. The sperm functioning is not as good. And in women, they're having issues with problems with gonadal functioning. When I say gonadal, I mean ovaries, and in men, that's testicles. They're having problems with making good eggs. They're having problems with sexual functioning because people are not sleeping adequately. They're not taking care of their bodies adequately. And sexual functioning is sort of like related to sports performance, because you're depending on circulation, heart function, cellular function. So if someone has chronic fatigue, they're going to have very poor sex drive. If they're complaining of fatigue at other times, poor sex drive. If they're complaining of fatigue, also the hormones that have to do with sexual functioning are going to be at a lower level. If someone's having anxiety, depression, any kind of mental illness, that affects, it can make things go up higher or lower, depending. Most of them, it lowers the sexual functioning. So it's important to address health issues and make sure that the blood sugar is well controlled. You know, and a lot of people think that their blood sugar is normal because their doctor is only checking like a fasting blood sugar. But a fasting blood sugar is very little information, and there are other ways that we can check the insulin sensitivity and check on blood sugar stability by looking at a number of different labs. Also, most people are deficient in vitamin D, vitamin C, sometimes the B vitamins. And I just was listening to a report yesterday talking about that a lot of people are getting cancer because the B vitamins that have been fortified, like in cereals and grains, has been synthetic B vitamin, and that the synthetic B vitamin may be causing some imbalances and some problems and may not be well metabolized in certain people. And some of those B vitamins have to do with our sexual functioning as well. So, alrighty, so hit the thumbs up, hit the subscribe button, hit the like button, and come back here next Thursday. Around noon is when I usually get started. And thank you for joining me today. I look forward to talking to you again soon. All righty. Bye-bye now.